And one of the most important things too is understanding that you all as Health Central, you have a wonderful reputation, a quality reputation in so many of the services that you already offer. Cardiology, as Dr. Einhorn talked about, obstetrics, pediatrics, neurology, neurosurgery. And one of the things that we need to help you do is invest in the strengths that you already have. So bring resources to you so you can actually expand the programs that you have right here with additional investments so that you can continue to grow and serve this community better. So key is investing. And then secondly, and I think one of the ways that our partnership could most benefit you is that we recognize the benefit of bringing new services to the Health Central community. So we can expand your current services, but let's bring new service to the current community. And we are committed to bringing our brands out to the West Orange community. The MD Anderson brand, the Winnie Palmer brand, and the Arnold Palmer Hospital brand. We believe that together, bringing these brands out here, we really can enhance both of our reputations and improve our market share. But more importantly, those brands and what those brands represent a very high quality of care that's actually recognized nationally. We've been recognized for our MD Anderson quality, we've been recognized for our pediatric quality, and we continue to focus in those areas. So we really would want to bring those brands. This is not new to us. We have just brought the MD Anderson brand to Dr. Phillips. We're taking the MD Anderson brand to South Seminole. Arnold Palmer Hospital is now in 4 different counties and various hospitals, and we're continuing to grow those services. So where it makes sense with our community partners, we want to make sure that we bring the strength of our brands in addition to helping you expand your existing services. And then we've heard so much about your vision, about your commitment to grow. Richard has been wonderful in sharing what your strategic vision is. And you know what? We believe in and we support the vision that you have for your 3 campuses. We think that is a very visionary approach to things. And when you look at it, we know that we need to create new facilities and infrastructure to support the investments that you already have and the enhancements and expansion we would have. So let's just take a look at the Health Central campus, the campus that we're on right now. You know, we can envision many things, but we know one thing that is really necessary is to build an outpatient pavilion. All of us know that so many of the inpatient services are moving to outpatient services right now, and we really need a place where we can house those outpatient services. So we could talk about some of the services that you already have existing, or we could bring some additional services down here also to be in your outpatient pavilion. Gosh, what great opportunities with skilled nursing and inpatient rehab. You know, the possibility to move your skilled nursing beds from the Health Central Park over to here, the Health Central campus, and combine that with inpatient rehab would really give patients the type of care that they need on that whole integrated continuum so that they have a smooth transition from inpatient to skilled nursing and to potentially to outpatient or inpatient rehab. And let me also just say, from our perspective, what we need to do is see how you all can leverage our strengths and our services. So I think one of the opportunities that we would have with this is that we need to bring our patients here who need skilled nursing care, and we have a real opportunity in rehab. I mean, we potentially could even move our whole rehab center from Lucerne Hospital here to the Health Central campus and combine our strengths. So I think it's all about that. It's about expanding existing services, it's about bringing new services and leveraging the services that you have so that we could both be better together. One thing I'm really excited about is your thoughts about the Health Central Park, that you're talking about transforming that into an assisted living facility. That's a wonderful idea. You know, with all of us aging and the needs for assisted living facilities so needed, and I hear little chuckles around the room, but you know, there are really needs for those services. But I think what would be really unique here is that there are hardly any assisted living facilities that are really tied to a healthcare institution. So that you not only, if you live in the assisted living facility, you have supervision for your activities of daily living, but your health care is totally coordinated with the Health Central campus. And that is something that I know the residents there would truly benefit from. And we would have the opportunity together to create one of the first living communities, I think, that had both of those components to it, the activities of daily living tied to the healthcare component. And then as Linda mentioned, you all were really visionaries when you were looking at Horizon West, and we also believe that that's going to be the next area of this community to grow, and we want to be ready with you to grow to whatever that needs to be. I mean, we have thoughts that could be an urgent care, freestanding ED, medical office building, post-acute, could even be a hospital if the population necessitates. So that's something that as we look to our future together, we can decide, you know, how we'd like to invest in that together, but it's a very important part of the long-term vision, and we agree with that. And then it's not just about programs and services, although those are the things we really like to talk about. It is also about economic development in the West Orange community. If we're going to be committed to you, we need to be committed to the economic development for this community. So if we expand your services, bring new services to the campus, we relocate some of our existing services here, we can create jobs for people, and we can create additional revenue streams for the West Orange community. And that is extremely important, especially in this day and age. And then we have all sorts of new opportunities where we can connect you, where you're not connected right now, such as our new relationship with the University of Florida and Shands. That is a very significant relationship with us. We signed a clinical affiliation memorandum of understanding a couple weeks ago, and this ties us together in terms of academics and research and in terms of expanding our clinical programs. And anything that we are involved in as your partner, we bring to you. So you all physicians would have the opportunity, if you want to participate in any of the academics, research, or helping with the expanded clinical programs, we now have a partner who would help us do this. We also have a new partner that if we evolve toward accountable care organizations, and we don't like to really think about that. We like to think about let's provide accountable care first before we actually move to a legal model of accountable care organization. But the University of Florida and the Shands connections allows us to clinically integrate and really form more of a regional presence in terms of what we do in terms of programs and services. And if you're our partner, you're all part of that, and we would be excited to have you as part of that. And there's a lot of other efforts that we have going on with other institutions, again, that are centered around our programs and services. I love Winston Churchill. I think he has some very profound things to say. But I like this quote: if we are together, nothing is impossible. And you've heard from all of us talking today, we are together. We've been connected in so many ways over the last 20 years. But now's the opportunity, and the commitment we have for you today is that we want to come together and we want to commit to your future and our future, but more importantly, we want to connect to securing our future together. And that takes us as partners in order to do that. So creating our future together. Well, we've done a lot of thought about this and had lots of thoughts. And a couple things about this is that, number one, we want to be a very good partner for you. And that we have a history of not acquiring hospitals for increasing our size and our scope of our facilities. That's not who we are. We also demonstrate a history that we don't go and acquire or merge with hospitals to increase our cash flow. That's not who we are either. But who we are is we invest in communities where we feel like we have partners where we could serve. And that is why we believe that healthcare is local. All communities, healthcare is local. So if you look at Dr. Phillips, you look at South Seminole, you look at Claremont and South Lake, you look at every one of those models is a little bit different, and every one of them have grown in a different way, and there's a reason for that, because they're all community hospitals, and we've responded to the community. We haven't gone in with a cookie cutter. It is just all responsive to those particular communities. We're also very concerned that our community hospitals keep their identity. I mean, that you're a part of Orlando Health, but that we keep the Dr. Phillips name and the South Lake name and Health Central name, because we're all part of a family with a parent name, but we all are siblings in that parent company, and that identity is very important. So that's something that we also bring to the table. And we also have looked at what might be the best structure for us, and we can only say that we want a structure that is mutually acceptable to both of us. This has to be a win-win for both of us. And we've thought about a lot of things, but right now, we're thinking that probably having a Health Central become a distinct 501c3 entity that is part of the Orlando Health corporate family might be the best way to go. But we also want to say to you that we are completely flexible, and that if we get to the next step in this process, we'll talk about this and we'll decide what is the best relationship for you, what's the best relationship for us. So we're not wedded to anything. We just heard what you said about what you wanted, and we heard that you want to enhance your quality and service. It's very important for you to keep your physicians intact. And it's very important for you to keep your team members intact, and that you all as a board, want some opportunity to participate in decision making. So that's why we came to the decision that we thought potentially a 501c3 distinct entity might help you best meet your needs. But again, we'll talk about it. We're really open to whatever we decide to do. And then we also know that whatever structure we come up with, that we have to commit to you that there is an investment to grow and expand your services, and you need to see from us that we have skin in the game. And we are absolutely committed to doing that. And no matter what our legal structure is, we want you to know that not only are we committed to the short-term vision of what you have for your healthcare campuses, we are also committed to the long-term vision of what we've just talked about. And based on preliminary analysis and optimal transaction structure, we believe that we can spend a minimum of $120 million toward investments in Health Central over the next 5 years. We also believe through this structure that we can increase profitability and operating margin so that we make sure that we can continue to invest in the viability and reinvestment to Health Central. And we want to make sure that through our investment that we can support the growth to meet the needs of the West Orange County community, which is very important. So recapping, everybody's talked about the connection, but I just want to recap it for a minute. So Orlando Health is the only one that really has this deep partnership with Health Central, 20 years worth. 3 out of 5 of the medical staff are part of us already. Orlando Health is the only one that's really aligned with your mission and values because you are all about community, and so are we. Orlando Health closely shares your vision for the future. We're the only ones that really do that, I believe. And Orlando Health desires your participation in government. Orlando Health brings the power of nationally recognized brands that I talked about. In Orlando Health, we are completely flexible in structuring our relationship. So we bring the power of our connection to you. And Orlando Health has served this community for over 100 years. At least I haven't been here that long, but they've been serving the community for 100 years. And we have just, through our team members and our physicians, I mean, we have accomplished things that we never thought were possible. And it's exciting to see the things we've accomplished. But you know what? The story's not finished yet. It's not finished yet. You know why it's not finished yet? Because you're not a part of it yet in the way that we really believe that you could be. So I think it's incumbent upon all of us to take that heritage that we share of Health Central's heritage and Orlando Health's heritage, and we turn that into a legacy. Because that's really what the opportunity is here, is to turn what we've started into a legacy. And you've heard a lot of words today, but I want to translate those words into pictures. And so I want you to look at this video, because this video is just an example of how we think we could translate our future together.